My name is Cynthia. I am 49 years old and I was diagnosed with HAE about 3 years ago. My first swell ever was a bump on my head and they thought I had hit my head, and then about a week or two later I got just really swollen, and it was after I had been at a sushi restaurant eating, so they were kind of linking it to a seafood allergy. And then from there I started going to the doctor and everything and trying to figure out what was causing this, and that's when they told me that most likely I had HAE, hereditary angioedema. I was very depressed. I didn't like the way I looked. I didn't know what it meant. I didn't know, like, what do they mean? I have to inject myself all the time, or I have to do, I have to watch for these triggers. It was very upsetting for me. It was very hard that things would hit me when I least wanted them to hit me. I would get a swelling. So being able to inject myself with RUCONEST has been such a blessing to me.
Hi, I'm Jan, and I'm a clinical nurse educator, RUCONEST Patient Advocate, and I know Cynthia because I worked with her and her family, helping her to understand her hereditary angioedema and how to self-administer her medication.
I have to say, Jan was like, she was like the sunshine on my cloudy day. It was very tough for me. My family was very concerned. I was concerned, and Jan came in and just, she was so prepared and so nice. And she literally spent like 4 hours with my family, which was so important to me. Like, it just felt like, okay, somebody like really cares here and is gonna help me through this. She taught me how to self-administer. She taught me how, about vein health and how not to use the same vein each time, how to bring out veins, to look for different veins. She also provided me with materials to practice on. She had a mat with, basically teaches you how to, where to put everything, what steps to do.
One of the ways that I help people get comfortable with self-administering their medicine is to bring materials for them to practice with. We have IV administration practice kits that has all the supplies that they would need to self-administer with, and let them play and practice. The actual administration of the medicine is the easiest part. And so we have demo arms that they can actually get a flashback when they have the needle in the vein, the practice arm. They'll see that, okay, it's in the right spot. I can go ahead and push the medicine. I have always felt that it was really important for people to understand what was going on and happening to them. And if they could be able to understand those things, that would help them to be able better to assist in their own care.
Being able to self-administer and her having the patience to show me how to do that was just amazing, and it really gave me a more positive outlook on my future life with this new, condition that I developed.
Patients can always give me a call on my cell phone. If I don't answer, or it's late, I definitely will get back to them within 24 hours.
Having RUCONEST as a treatment has been so empowering. It has given me the confidence to go back to things that matter in my life. Now that I know I have a treatment for it, I'm able to self-administer whenever I want. I take my medicine with me everywhere, so I always have that ability to self-administer and be able to keep my swelling at bay.
RUCONEST is an injectable prescription medicine that is used to treat acute attacks of hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. Important safety information. Do not use RUCONEST if you have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums turning blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Tell your healthcare provider about all your medical conditions including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events, product complaint reports, and medical information, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.